When I found out I had cancer, we knew immediately we would be doing some traveling. And I'll admit we didn't know how much traveling we'd be doing. As I look at my commute to go be treated or visit with providers, on a good day, no traffic, no stopping, it's 2 hours from door to door. For my radiation series, 28 days in a row, traveling up and back, I tallied it up and I could have driven coast to coast 3 times in that 28-day period alone. And I've made many, many more trips than that.
The Rural Huntsman at Home program is situated in 3 rural counties of southeastern Utah, which are between a 2 to a 5-hour drive one way to Salt Lake City, where the Huntsman Cancer Institute is. And so for a patient to have a concern that brings them, first of all, they have to navigate a 2-hour or more drive, including over a high mountain pass that in the winter is many times not passable.
The Huntsman at Home Rural program is bringing specialty care to the patient's community. So we literally bridge the gap between the Huntsman Cancer Hospital and the patient's front door. And we do that through providing nurse practitioner visits. So that could just mean symptom management. It could mean, we get them a prescription for something for nausea, or maybe they need IV fluids. And those are the things that help keep people out of the hospital. Those are the things that really matter. It's just the right care given at the right time can make a huge difference.
Where we're able to call and talk to Angie, and if Gagling needs an adjustment in her medicines, she can just deal with it and we don't have to go anywhere. And that's the biggest convenience of it is having that connection right in your home.
The area we live in, we're very isolated. There's an hour of isolation in every direction. We have the canyon, we have the desert. I've had to meet patients at the edge of their field to do a blood test on them because they have to get their hay up. I understand what makes them click, and they have needs that they have to meet. And I think that trust is what helps us be effective, right? Is we know that they have things they have to get done. If they're a coal miner and they're on a long wall move, they're working 30 days straight, they can't get that time off. We need to modify when we see them, whether it's extending our hours or seeing them somewhere else. The flexibility this program gives us to be able to meet people where they are is incredible.
How are you?
The strength of being in a rural area is that we are so connected and we know each other very well and we're very committed to helping each other. So the services that we're bringing in are really just plugging into that and building on that foundation.
The ARPA-H PARADIGM project allows us to extend what we're doing in several ways. One is to bring in high-level diagnostic devices so that we can treat patients at home or in our mobile vehicle. Secondly, one of the things we want to provide patients is some of their treatments in our mobile vehicle. And that includes chemotherapy and immunotherapy. So at least for some of their treatment days, they can have them in their community rather than needing to come up to the cancer center for them. And third, we want to extend the opportunity for rural and frontier patients to more easily participate in clinical trials.
There are many barriers, I think, for all patients considering clinical trials, but especially for those of our patients who live far away from Salt Lake City or the Huntsman Cancer Institute. Depending on the medication that's being studied, it may require the patient to return to the Cancer Institute several times in 1 week or every week, sometimes for hours at a time. And you can imagine someone who lives 5 hours away, it's impossible for them to, take the time out of their work schedule, their family life, even the care of their, cancer to come back and forth to the hospital all that time.
ARPA-H PARADIGM project will allow the Huntsman Cancer Institute to demonstrate how we can distribute cancer care all over the area that we serve. It will show that care does not have to be solely based at a bricks and mortar cancer center, that in combination with the important resources that are needed at the cancer center, that patients can also receive a portion of their treatment at home.
Patients have a sense of comfort in coming to the hospital, but what we're doing with this project is actually bringing the hospital physically to them on a mobile unit. So when we talk about transforming healthcare, we really are. It's a different way of bringing the healthcare directly to the patient. So bringing that high-level cancer care to their neighborhood.
The chemo itself wears you out, and then the traveling. So it takes me probably 2 to 3 days to recuperate after traveling that far. I love spending time with my family, my grandkids, and sometimes I'm just so tired that, I don't enjoy it as much as I would like to. So to have that at home, closer to home and being able to do that.
It's a necessary burden to be able to take care of her, to do what we're doing, to where if it was able to alleviate some of that, to where we could have it down here, it'd help our lives a lot.
This project has great significance and potential impact for every community in the United States and for chronic disease management broadly. It is helping us to rethink about how we provide care and where we provide care.
It can't get here soon enough. Maybe not for me, but for others that truly struggle to travel, whether that's a burden of health, a burden of finances, a burden of travel. There are people in our community and other communities throughout the country that need this now. We just hope they get it done quick. I'm gonna beat cancer, and I'm gonna be around a long time, but there's some people that this may be their only option to help them extend their life or save their life, and it can't get here soon enough.